Disease development from Yin-Yang perspective. So we have here pathogens or evils, factors disturbing the balance of the body. Is an excess, and then excessive yin evils invasion of an external dampness or coldness. To ulitin ko po. Pathogens, evils, factors disturbing the balance of the body will conflict the health cause, healthy energy, the body's resistant and self-healing abilities. And then
Are you having trouble with your signal, Ma'am Teresita? Hello po.
yes po. Hello Doc.
Oo. So maybe we
Sige
can,
po.
sige, balik ka tayo mamaya, no? So
Sige Doc.
I'll probably, Okay, let's talk about disease development from the yin-yang perspective. Okay, as you can see here, the reason why people come to us is nagme-manifest na po talaga yung disharmony or imbalance. So we have two ends of the spectrum, no? So we have the pathogens, which are called evils. Then we have the Zheng Qi, or the healthy energy, or what we also call the upright Qi, no? So they will be in conflict if there is a war, of course. So pathogens or evils are factors that disturb the balance of the body, while the Zheng Qi is the body's resistant and self-healing abilities. So every time there is yin and yang disharmony, there will be conflict. So when you have the predominant, like if you have the pathogen invading, okay, that's actually called excess. So when you have a very weak immune system or a very unhealthy Zheng Qi, then you will have deficiency. Okay, so let's talk about excess. You can have both excessive yin evils and excessive yang evils. Excessive yin evils, for example, we have invasion of external dampness or coldness. An example of excessive yang evil is invasion of external wind or heat. Now, on the other side of the spectrum, we have if you have yang qi deficiency, this is a physiological under-functioning. So that means if your yang is very deficient, then it cannot actually control the yin. So welcome niya po si external dampness or coldness. Yung isa naman, we have the deficient yin essence, no? That means you have insufficient nutrient materials. So you can definitely not protect yourself from excessive yang evils, no, external wind or heat. Okay, so you have yin excess on one side, yang deficiency on the other side, then yang excess or yin deficiency on the other side. So let's review the qi development here. Acquired qi can be stored and replenished and is composed of Ku qi or spleen qi derived from food and sustains the physical body. Then we have the lung qi or Kong qi, which is derived from oxygen or the air we breathe. Then we have the chest qi or the ancestral qi, the Zhong qi, derived from the gathering of, it's basically the combining of Ku qi and Kong qi in the chest. And this should be acted on by the Yuan qi or original qi to form the true qi or Zhen qi. Now, Zhen qi or true qi is composed of nutritive qi and wei qi. So this is just a review. So let's talk about the root and manifestation of disease. Okay, so the principle. So if the disorder is acute, you treat the manifestations first. However, if the disorder is chronic, so that means when the patient comes to you, wala masyado siyang problem, but it's a problem that has been bothering him for quite some time. So you treat the root. Another is simultaneous, or when do you do simultaneous treatment of root and manifestation? So you can have different treatments for the same disease or same treatment for different disease. And we treat disease according to the season, environment, and the individual. So let's compare acute with chronic conditions. Okay, so acute conditions, a very common example is when you have a throat infection, strep throat, or a broken bone. You just met an accident, vehicular accident, no? So at the beginning is very rapid, okay? And the cause is usually only one. Duration is short. The diagnosis is commonly accurate, and the tests are often decisive. Treatment, the cure is common, and the role of professional is to select and conduct the therapy. And the role of the patient is, of course, to follow the orders and the advice of the therapist. Now, for chronic conditions, diabetes, heart disease, and arthritis. Okay, so the beginning is gradual, up and down, and there are many causes, and the duration is indefinite. Diagnosis is often uncertain, especially early on. No? Tests are often of limited value, kaya minsan gumastos na ng dami na wala pa rin. And treatment, the cure is rare. So you will be looking at a maintenance treatment. No? The role of professional is to teach and advise, and the role of the patient is should be the partner of the health provider. That is, if he wants to be responsible. And this is okay. And you know, it's like working together with your health professional, which is very, very advisable.